Hi everyone, it's me, Crowned Regal. I thought it was important to share some of what my experience in having cicatricial or scarring alopecia is like. It's important for me to also mention that I am not a skilled medical person and I'm sharing my experience with having this disease. Only a trained medical physician with knowledge of skin disorders, particularly with disorders of the scalp and hair, can advise you of your diagnosis, treatment, medications, and aftercare should you feel you have this condition. Further, I do not endorse any treatments or any medications of any kind. Now that I got that disclaimer out of the way, just some quick facts about cicatricial alopecia. Cicatricial or scarring alopecia causes permanent damage to the hair follicles. The causes of cicatricial alopecia are considered either primary or secondary. In primary cicatricial alopecia, the hair follicle is the target of the inflammatory destruction. The dermis is the second layer of skin, and that's where the hair follicles are located. Secondary cicatricial alopecia is when the hair follicle is destroyed indirectly because of another cause. Primary cicatricial alopecias are a group of complex disorders, and little is understood regarding its causes because it's rarely seen in the clinics. Secondary cicatricial alopecias are caused by other damage to the scalp, like chemical burns, blistering disorders, inflammation, traction or tension to the scalp, and certain types of infections. There is no cure for this, and the treatments that they provide for this disease is just to slow down the symptoms, and the progression of the disease is the focus. Again, there is no cure, and the treatments that one might receive for this disease is only to slow down the progression of the disease, and the focus is on relieving the symptoms for the patient. A diagnosis of cicatricial alopecia is made through clinical inspection of the infected areas of your scalp and a biopsy, where your doctor may snip a piece of the infected area for inspection in a laboratory. Treatments might involve oral antibiotics, topical creams, ointments, anti-inflammatory medications. Topical medications may include corticosteroids, and corticosteroid injections might be injected into the scalp where the infected areas are. And many times the treatments are very aggressive and involve all of these treatments I just mentioned simultaneously for extended periods of time until the patient is free of any symptoms that they might have. Patients can experience the symptoms over and over again. Like in my case, I've had these symptoms for years, and the earliest I can remember getting it was right after my first child was born, and that was over 30 years ago. And lastly, there are many variants of cicatricial alopecias which require specialized treatments. So everybody that walks in to a dermatologist may get a different type of treatment than someone else. CCCA, or Central Centrifugal Cicatricial Alopecia, is the type of scarring alopecia I was diagnosed as having. No one knows for sure why I have it, how long it's been dormant, or if it's autoimmune related or not. Also, what isn't known is whether some of it is primary versus secondary or both. The only thing we know for sure is that my condition is permanent. My hair follicles that are damaged are permanently damaged, and I cannot require, or I'm not eligible for a hair transplant or anything of the sort because the areas are just too large. Well, see, I've had these infections on my scalp for years and have been diagnosed with things like seborrhea, lichen planopilaris. I've used chemicals like perms, dyes, etc., just like any other woman. But I've also worn tightly braided hairstyles, and I have a history of some autoimmune disorders. And asking how or why I have this disease is like asking which came first, the chicken or the egg. To make matters more complex, I was also diagnosed with a form of non-scarring alopecia, alopecia totalis, which is definitely autoimmune. And in those areas, my hair may grow back at some time, and then I may lose it again. My other issues, well, I have some unique issues with having scarring alopecia that maybe people who have non-scarring alopecia may not have to deal with. One of the things that I have to be concerned with is should I cover up my scalp due to an occasion, the cold weather or the rainy weather? What if it's really hot and I sweat? Can I cover up my head today? It may be irritated due to inflammation. Should I take something to relieve the pain, the stinging, and the severe itching? If I go out in public, whether anything on my head should be there, and having the person sitting behind me on the train not be distracted by the pus, the scaling, red bumps and sores on my head, and without me feeling self-conscious about it. Why do the flare-ups happen? No one knows, but I have made the correlation between me being under a lot of stress and my outbreaks. And lately I've been under a lot of stress, an extreme amount of stress. And just recently I had a very bad breakout. So with those things in mind, I would like to show you some images of what my flare-ups look like. I want to caution you, they're kind of gross. So if you're squeamish about seeing scaling and that type of thing, you may not want to watch it, but I just thought I'd warn you. Hopefully these images will help someone out there who may think they have it, or at the very least, encourage them to go see about a scalp condition that they may have. They may be able to save their hair in those instances. So thank you for your time. Thank you for viewing the video. And